Hi, good morning. I'm Isaiah, and today I'll be talking about the 3 C's of first aid. 3 C's of first aid are call, check, and care. But the three C's of first aid are important steps you take in the situation of emergency. And starting off with the first one, check. You're going to check and assess the situation. For example, if the victim is in an unnatural environment and the environment is not safe, you should probably move the victim to another area. For the second C, which is call, you're going to call any emergency, any local emergency number or 911 to activate emergency services. And for the final C, 3, which is care, you're going to perform any first aid on your victim that is deemed necessary. Depending on the victim's condition, what could be first aid like CPR, choking first aid, shock first aid, or stabilization. For my next one, I'm talking about is universal precautions. Universal precautions are steps taken, just normal things you do or any healthcare worker do. Universal precautions are essential for ensuring safety among healthcare workers and patients that might come into contact with blood or any human bodily fluids. Steps that can be taken to avoid this would be 1, just wearing gloves, 2, washing hands after any type of first care, and 3, washing clothes that may or may not come in contact with any bodily fluids.
When dealing with types of burns, you have to realize what type of burn it is before you try and take action. A first-degree burn can look like a little sunburn that's kind of dry on your skin. It can look like this, or it can look like this. When dealing with it, you add boiling water for up to 10 minutes and apply Olay lotion. Don't use ice stuff. But if it's a second degree, it could look like a blister and type of painful. You cover it with a clean, non-stick bandage. Take pain relievers, but don't put any butter or ice on it. A second degree burn can look like this, or it can look like this. And then lastly, a third degree burn is the most severe. It can look white and skin could be flying off. It could also look black and leathery. Call 911 immediately and cover with a clean cloth. Raise the area if possible. Do not use water or put clothing on it. And it can look like this, and it can look like this. Be safe knowing the type of burn you have. When you have an open wound or bleeding, you first want to make sure that blood cannot come out. So whenever you see blood gushing out, you immediately try to press it with your hand. It can be on your arm or it can be on your leg, anywhere. But make sure the first thing you want to do is stop the blood from coming out. Once you find something to use to apply it or you bandage it, you can do it 3 types of ways. You can wrap it around, you can wind it like a tie, you can secure it with a physical bandage, or you can get 911 to do it professionally. But first, again, the steps is first pressure, then get something to put on it, and then wrap it around.
If someone isn't breathing or has collapsed, you can save their life using these 5 steps. First, make sure the scene is safe, and tap and shout. See, are you okay? Are you okay? If there's no response, move on to step 2. Find 2 people who hear you. Tell one of them to call 911 and one of them to call an AED to get an AED. And then, if someone isn't breathing or has collapsed, you can save their life using these 5 steps. First, make sure the scene is safe, and tap and shout. See, are you okay? Are you okay? If there's no response, move on to step 2. Find 2 people who hear you. Tell one of them to call 911 and one of them to call an AED to get an AED. And then open the airway by lifting the chin. Then look, feel, and listen for breathing. No more than 10 seconds. Then if they're not breathing, give them 30 chest compressions, hard and fast, in the center of the chest. Then 2 rescue breaths. And you do that 30 times. And keep going until health arrives or the person starts breathing. So similar with the adults, for an infant, since they're a lot smaller and more delicate, you will use 2 fingers. same place as an adult and do compressions 30 times and then stop for a breath. Same thing as an adult, except use 2 fingers and be a little bit more delicate.
Perform first aid for choking for an adult. Stand behind the victim and reach for their wrist like this. Position one clenched fist above the navel and below the rib cage. And using your free hand, pull the clenched fist sharply and quickly upwards 5 times. And repeat until either the object is dislodged or they become unresponsive. If they are pregnant or obese, perform chest compressions instead. If they become unresponsive afterwards, have someone call 911 and begin CPR. To give first aid for choking for an infant, sit down and hold the infant in your arms facing down. Use the heel of your hand to give 5 gentle yet firm blows between their shoulder blades. If this doesn't dislodge the object, perform 5 chest compressions as in CPR. If they're still unresponsive, keep repeating the chest compressions and the back blows while having someone call emergency services.